sector to support the quest to end tuberculosis by 2030. Coordinating Minister of Health, Professor Mohammed Ali Pate, made the appeal at the launch of End TB Strategy held in Lagos. Our health correspondent Aminat Elegushi tells us more.
Tuberculosis is one of the most pressing public health challenges facing Nigeria, and addressing it remains a significant concern for the government. Hence the need for partnership to achieve its end come 2030. Over the years, Stop TB Partnership Nigeria has initiated advocacy for increased resources and mobilized critical stakeholders for increased domestic resource to support TB prevention. At this official launch of private sector strategy to end tuberculosis in Nigeria, Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, seeks for a matching fund deal to end TB.
So if we are able to strike this deal to mobilize from the domestic private sector for resources that you can hold, not to government, but to hold it, not to use it for overhead and stuff, but actually to go towards finding cases and treating them. I comment from the government side that we will step up, we will try to match it with our domestic resources in the public finance, in the budget, but also will not ever go to match what you are able to put on the table.
We might be able to put in a lot of manpower, we might be able to do a lot of health education for our staff and our people out there. That is how we want to partner and invest. While another sector might be putting in the finance, the funding, the gen experts and stuff, but people in the health sector, there's a lot we're going to do, and like I said, we want to change our strategy. It's action, not words. Enough of talk.
Various private sector pledged their support to eradicate tuberculosis.
I like to do health deals, and we will do a health deal. The deals must be sustainable, they must be smart, okay, and of course, they must have a big impact.
So we have a staff strength of 48,000 people, and what we will do, starting tomorrow, is making sure that everybody that is covered by our HMO program has TB screening as part of what is going to happen today.
The need for all hands to be on deck to end TB was also emphasized.
We're screening and finding more cases, so the drugs to treat them, in fact, could be a challenge, let's say from next year, from mid next year. So we're anticipating that. While federal government will do more in 2025, we're also offering the opportunity for the private sector to also do more.
It is hoped that the matching fund of $50 million, which 50% is expected from the federal government and 50% from the private sector, will go a long way to end tuberculosis come 2030. Aminat Elegushi, LTV News.
Thank you, Aminat.